Hi, my name is Shannon. I'm a dual enrolled student. I'm doing my RN at CNCC, and I'm in my second year, just started. I currently live in Steamboat. I am going to be doing my clinical rotation for public health at Routt County Public Health. I will be their first student that they've had as a intern. It will be a learning curve for both me and my nurse. So I am very excited. I will be working with one of the pharmacies as well to try and do the vaccine clinics. Currently I work in the ER as an EMT. I have a dream of one day being a RN nurse. Some of the ways that I believe public health and my job as an EMT in the ER are similar is that I do a lot of skill set in the ER, but I also do a lot of the paperwork, a lot of consulting, finding contacts for certain patients, setting up appointments, even like organizing flights, kind of things along that line, which I do know public health is there for people to find resources. So I think that is where kind of those two jobs will align. Where they're different is public health does focus more on prevention, kind of like putting things out in the community to prevent people from getting ill, or even like educating people on their health, kind of signs to look out for so they don't end up in the ER. Where the ER is more like a treatment. People are generally not in the best state. They usually wait not too long. They usually like wait to a point where their illness is so bad they feel the need to come to the ER. Another way that they're kind of similar, especially in this town being a small community, is we do see kind of trends where, for example, like in the last few years, I have noticed a lot more like mental health patients, as well as alcohol and substance abuse patients, people withdrawing, where public health can kind of gather that information from the ER and utilize it to provide more resources in the community. One of the resources that have been started in the community in the last, I believe, 3 years is the Health Partnership started a organization for people who are either in recovery, seeking to be sober for lifestyle, or even like people who are curious about going sober. And that has actually taken off. So I think that's a really cool part of public health, which I'm very excited to see more about. So how my future work as an RN can kind of align with public health is kind of like understanding more the preliminary health determinants, as well as like kind of what population I'm working with. So for example, in Steamboat, we have a lot of, like in the actual town, there's like, you got people that are here working for the ski resort. So, lower income people, however, they are close to the hospital. So they do have access to healthcare. They generally do have like support systems. However, their physical environment can be stressful. There are a lot of people here that are living in houses that there's like 3 or 4 of them to a room, which during COVID was a nightmare, because if one person in the household got COVID, the entire household would get COVID, which can also go along with other diseases. We also have second homeowners, very high income people. We have a lot of farmers in the area, not so much directly in Steamboat, but outside of Steamboat, we take care of patients in Walden, or from Walden, not in Walden, from Hayden, Oak Creek, North Routt, just all over, who generally have just different views on the healthcare system. Some of them don't have transportation all the time to make it to their appointments. Some of them do have support systems. Some of them don't have support systems. Some of them are elderly and live alone. So that's definitely something that when you have a patient that comes in from Walden versus a patient that comes in as a second homeowner from Steamboat, you kind of have an idea of where maybe their like mindset is on the healthcare system, as well as like maybe how they've been taking care of themselves, and how they're going to successfully be discharged and be set up for success. So the population that I will probably mostly work with here in Steamboat are the elderly and children. I will be doing the vaccines for elderly, like shingles, and then I'll also be doing like school vaccine clinics. So both vulnerable populations. I'm gonna have to keep in mind like education is important. However, it would be also beneficial for them to have a support system there with them to also hear the education piece. And then I just need to be mindful of kind of like where their minds, like their views on the healthcare system, as well as like how healthy they are. Yeah. So one of the projects I would like to do, and I meet up with my nurse mentor on Friday, and then I meet up with my clinical mentor tomorrow. So I'll have a better grasp of what I will be doing this semester at the end of the week. But I would like to focus on kind of more resources for the elderly population. Our long-term care used to be in the hospital, and they would have the children from the daycare come in every day and hang out with them and just kind of interact with them. And it just like raised everyone's spirits. They were a lot happier. And I have noticed in the last year while doing clinical rotations at Casey's Pond, which is our long-term care, that the elderly people there, the residents, they have not been getting as many visitors. They haven't been getting out as much. They're just like, some of them just still feel like stuck in that building. So I would love to kind of come up with more just like activities and resources for them to like get out more and interact more with other people, not inside their home, or even just people in the community that need more interaction, which I will get some pushback from that since the pandemic is still going on, and it does depend on the health of the resident, the health of the child, what the parents allow, kind of what the facility allows. So it's gonna be very interesting trying to do that. So yeah.